Once removed, you will have a stitch at each drain site, which will be removed after 7 to 10 days. If you have been discharged before this, we will arrange for a district nurse to do this. Personal hygiene. Initially, the ward nurse will help you with your personal hygiene at the bedside. However, after a few days, you will be able to go to the bathroom or to have a bath or shower. Your heartbeat. After the operation, you may feel that your heart sometimes misses a beat or is racing. This is not uncommon after lung surgery and should not hinder your recovery. If you are aware of this, please inform your ward nurse or doctor. If this is detected during your hospital stay, you may be prescribed tablets to control your heartbeat. If, however, this becomes a noticeable problem whilst at home, consult your general practitioner. Eating and drinking. Initially, your appetite may be poor, so try to drink and eat a little when you can, as this helps with wound healing. The dietitian will offer nutritional support if required. Constipation. Indigestion and constipation are also common, as your normal functions may slow down during surgery. Some patients suffer from nausea as a result of anaesthetic and the drugs. Do ensure that you inform nursing staff should this happen to you, as it can be treated. Mobilisation. We will want you to be up and about quite quickly, depending on what type of operation you have had. You should be able to walk around your bed within 2 to 3 days. The physiotherapists and nurses will help you to carry your exercises regularly. Exercise is encouraged to prevent stiffness, bed sores and constipation. It will also help your lung function. In addition to your support stockings, you will also be given a small injection of an anticoagulant, which is medication to help the blood flow freely and prevent clots from forming. You'll be shown how to move yourself without putting strain on your wound. However, if you're unable to move yourself, the nurses will assist you and may use a lifting aid such as a hoist. Wound. Most patients have chest surgery have a wound that will extend from just under your shoulder blade, around the side of your chest, to under your armpit. The nurses will check your wound regularly until you leave hospital. It's important to report if there's any redness, pain or leakage from the wound, so this can be treated appropriately. You may have stitches in your wound that will need removal 7 to 10 days after your operation. If you are discharged beforehand, the ward nurse will arrange for a district nurse to remove them at home. Breathlessness. If you find you're experiencing breathlessness, you should inform the ward staff. The physiotherapist may show you the positions that are described below, as they may ease it. In addition, if you can concentrate on breathing out slowly, this can help to control your breathing. Try leaning forwards while sitting in a chair with your forearms resting on your thighs. Try to keep the upper chest and shoulders relaxed, therefore keeping the lower part of your chest free to expand. Discharge home. The length of stay. You should expect to remain in hospital for 7 to 14 days after your operation. This may vary according to the individual, and your progress will be assessed closely by the doctors and nurses. Transport home. We'd advise that a relative or friend accompanies you home on discharge, whether by driving you home or by taxi. Wherever possible, you should try to arrange your own transport home. If, however, you are unable to do so, you should let your ward nurse know on admission, and ambulance transport will be arranged to take you home. What happens when I go home? Before admission, please give some thought to how you will manage after discharge. The following information may answer any questions you have. However, please feel free to be able to discuss any concerns you have with your ward nurse during your stay. During the first few days at home, you may feel quite vulnerable, so it's an advantage to have someone at home with you during that time. If you live alone, please discuss this with your nurse on admission. It may be necessary for convalescence or support at home to be arranged for you by the hospital social worker. Medication. Prior to your discharge from hospital, you will need to receive a supply of the tablets, which you will need to continue to take at home. The nurse will explain the reason for medication and when you should take it. If you have any questions relating to your medication, then a pharmacist is available for advice. If you're unsure about when to take your medication, please ask for written instructions. Repeat prescriptions. Prior to your discharge, you will be given a letter to give to your general practitioner. This letter contains a list of the medication that your general practitioner should continue to prescribe for you. This will also contain information about your hospital stay. This letter needs to be taken to your GP surgery within a couple of days following your discharge home. Your GP will then have up-to-date information about your medication and your condition. A detailed letter will also be sent to your GP by your surgeon. We would advise you contact your GP surgery within the first couple of days of being home, as it may be necessary for you to make an appointment to see your GP to discuss your progress and arrange a further prescription. Medication. Frequently asked questions and the pharmacist's response. The label says, take half an hour to 1 hour before food. Does this mean I have to eat a meal an hour after taking my tablets? No. In most cases it means that the medicine works better if your stomach is empty. Take the medicine half an hour before a meal or 3 to 4 hours afterwards. Small snacks such as biscuits do not count as meals. The label says with or after food. Should I skip my tablets if it's not mealtime? No. Food protects the stomach from tablets which can sometimes upset it. A glass of milk or a small amount of food such as a biscuit will protect your stomach if it's not a mealtime. The label says 1 tablet twice a day. Can I take both tablets together? No. Some tablets don't work for long enough to only take once a day. Unless you've been told differently, take 1 in the morning and 1 in the evening. If the tablet will work all day, then we will write 2 tablets daily on the label and you can take these tablets together. I find it hard to open child-proof lids on tablet bottles. Can I have plain lids? Yes. Ask your pharmacist when you hand in your prescription. Remember to keep the medicines in a safe place away from children. I always feel sick after taking my tablets. Is there anything I can do to help this? Yes. Try taking the tablets after food. Do not do this if the label tells you to take them before food. I find it hard to remember to take my tablets every day. Is there a good way to help me remember? Yes. Some people find that using a calendar or diary helps. Keep them with your medicines and tick off when you've taken them. You can also purchase a compliance such as a dosette box from your pharmacy. This box has separate compartments for you to place your medication in. These compartments are labelled with the times of day to take your medicines. Ask your pharmacist for details. Is it alright to drink alcohol when I'm taking medicine? It's usually alright to drink alcohol while taking medicine if the label on the bottle does not say avoid alcohol, your doctor has agreed that alcohol will not affect your illness, you have only 1 or 2 drinks and do not drink to excess. If you have any other questions about your medicine, speak to your doctor or pharmacist. Resuming activity at home. Most people find it takes approximately 3 months after the operation for them to make a full recovery. Obviously, there is considerable variation depending on how fit you were before your operation and the type of operation performed. Generally, people who have had part or all of their lung removed take longer to recover than people having other types of lung surgery. Age is also relevant. Older people may require a longer period of convalescence than younger people. Exercise is an important factor in your recovery following surgery. For the first few days, take it easy and restrict yourself to the house or garden. After a few days, you should take a short walk on the flat, gradually increasing the distance and gradient over a period of weeks. Initially, it's advisable to avoid going out on cold, wet or windy days. Your aim over the next 3 months should be to increase your activities day by day. Introduce new activities, but not all at once. You should, however, get into the habit of taking regular exercise. A lot will depend on the nature of your surgery and your age. Exercise within your limits. Activities that involve carrying or lifting heavy items, shopping, hoovering, etc., should be avoided for 6 weeks following your surgery. You may experience some breathlessness while you're carrying out activities, which is acceptable as long as it's not distressing for you. A good way to know if you're overdoing things is to be able to talk at the same time as exercising. Always rest between periods of exercise. Try and get a good night's sleep. If you notice yourself becoming easily tired, you are probably overdoing things, in which case reduce the distance you are walking or the activities you are doing. The amount and type of exercise which patients are able to do in the early weeks is extremely variable. The best guidelines are to do what you can without becoming too tired or short of breath. Guide for the first few weeks at home. The following advice is for guidance only, and it contains some information regarding specific activities. First week. Walk around at home as you did in hospital. You should continue with the breathing exercises the physiotherapist has taught you. Do make sure you get plenty of rest and do not have too many visitors. Second week onwards. You should gradually introduce light tasks into your daily routine, for example, dusting, washing up, and cooking light meals. Do not do anything more strenuous at this stage. Particularly avoid heavy lifting, pulling, or pushing, as this will place a strain twisting movement on your chest. For example, walking an energetic dog. Do not lift children or grandchildren. 4 to 6 weeks. You can gradually introduce more demanding tasks such as ironing, light shopping, light gardening, or cleaning the car. After 8 weeks, your wound should be healing well, and therefore other tasks such as hoovering, raking leaves, driving the car, and small jobs within the home may be undertaken. After 12 weeks, you may wish to resume or take up other activities, including cycling, fishing, walking, and swimming. At first, it's better to use a heated swimming pool and the stroke that feels most comfortable for you. If you play golf, you may start practicing your swing and hitting a few balls at this time. If you wish to play competitive games or contact sport, you should consult your general practitioner or consultant surgeon.